All right, back live with you tonight and in focus, and thanks for staying on. Gauteng Denosa is at loggerheads with the Gauteng Department of Health. This is over more than 1,000 healthcare workers not receiving their April salaries. The department argues that administrative issues are at play, resulting in the delay of payments. For more on this, we're joined now by Gauteng Denosa Secretary Bongani Mazibuko. Good to have you, and thank you very much for your time. Is the line of communication open between yourself and the Gauteng Department of Health, at least?
Good evening, and thanks for having us. Well, I would say it is, because we have at least been engaging, and there were promises that have been made to say that the said employees should be paid on or before the end of the month of May.
How did we get here, and how do we ensure that this does not happen?
Unfortunately, someone has been sleeping at the wheel, or some people did not do their jobs, which is the reason why we are saying that heads must roll. We started engaging on the issue of COVID-19 contract workers from as early as February with the department, and it was agreed that those contracts would be extended again in the financial year 2023-2024. But unfortunately, some people did not do their part, and those who did their part, the employees were paid their salaries of April. And unfortunately, it was a large majority of the ones that did not do their job, and hence we've got more than 1,000 workers who had not been paid their April salaries.
Yeah. Talk to me about those 1,000 healthcare workers. What categories are we talking about? What designation are we talking about?
We're looking at mostly doctors and nurses, and we do have other healthcare workers, the radiographers and so forth. But the majority of them would fall under the categories of doctors and nurses. Yeah. That is the information that we've got so far, yes.
And these are all former COVID-19 staff, so to speak, for lack of a better word, but those are those staff members that came in during that time. Now, the administration of it, they're saying it is at Health, at eGov, and at Treasury, because they are the departments that are involved in the recruitment process. Explain what actually happened there.
Well, the department would be in a better position to explain that part. But for what we have on our side is that we had an agreement with the Department of Health that nurses and doctors who were on COVID-19 contracts should be their contracts should be extended, and the department failed in that regard. And part of it is that documents which were supposed to have been submitted were submitted late, and as a result, if it was that it was totally the mess was totally in Treasury and eGov's doorstep, then some of the nurses and the people that got paid would not have gotten paid. So it means then that between the three departments, the communication and whatever challenges they've got, they need to sort it out. We are saying that the Department of Health is the primary employer, and they're the ones who need to ensure that these people get their salaries. So we can't be saying we're wanting to now point fingers at other departments because we failed to do our jobs. So yeah. To us as Denosa, we are saying that someone somewhere in the Department of Health failed to do their job timelessly, and it's a clear dereliction of duty.
It does appear to be so, and it looks like a complex situation for somebody who might not understand. You know, working here, we've got one HR department. So if you are not paid, you go to one department. They are talking about 3 departments. How does it normally work? I mean, is it the hospital that you work at that is supposed to submit the documents for you, or is it the provincial department that is supposed to handle that administrative part?
What should be happening is that you submit your documents at the hospital where you are appointed, and then from the hospital will then facilitate and send the information to central office, which then sends it to eGov, and then eGov is the one that processes the payments, and they'll tell you that this is the envisaged date of payment. So now that is expected to be a smooth running process, and in normal circumstances, we are not expecting that such a high number of people would be having challenges. Now, when we have challenges of this magnitude, it means then that somebody either did not submit on time, or somebody did not get the authorization that they were supposed to get. So, in essence, it comes back to somebody not doing what they're supposed to do on time. You know,
and where do you place that break? Is it at the hospital level?
Well, the hospital is the ones that are supposed to do it, but at the provincial level, they are supposed to ensure that these things are submitted on time, and they are supposed to be managing the people at the institutional level. And the buck stops with the CEOs in these institutions. So what did the CEO do? Being a CEO of a particular facility, and you know that you've got 30, 50 workers who are working under you, and these people are not going to get paid. What did you do when you received that report? So to me, it means then that that particular CEO did not do his job.
So except for an apology and a promise of rectifying this in a process of 2 weeks, what else are you getting? I mean, where does that leave your members? I'm sure that means whatever they needed to pay in the 6 weeks has not been paid.
Definitely, exactly. It's a very frustrating situation, because you now have people who have not been paid for a month, and these people now have to go out and borrow money to get to work, and some of them are not able to pay rent, as we know that not all of us are able to buy houses in Gauteng. And even if you had bought a house, if you're not paid, it's not all of us that would have savings enough for you to be able to pay the bond for the next month. So we are in a very difficult position. And as well as a union now having to engage with the department, you're getting all these promises to say that this is going to happen then. So the focus at the moment, I think the most pressing matter is to make sure that these employees are paid what's due to them by the end of the month as promised or before. And then we need to follow up and find out now. There needs to be a clear investigation to say who did what, who dropped the ball, and then what's going to happen to them. That will be the next thing that we need to do as Denosa, to follow up with the department. And they need to, someone needs to pay. It takes us back to what we raised with the former CFO who's currently on suspension in the department. We kept on saying that something needs to be done, because even then it was the same thing when nurses were not paid. And we had to rise up and make noise about it, and then only did the nurses get money that was due to them.
Meantime, what has been happening with your members? Have they been able to provide services to the various facilities?
Well, the nurses and doctors are committed to their work. They have been coming to work. So the service delivery has been to a minimal, because those who have not been able to come have reported, and arrangements have been made to make sure that they cover. So service delivery has not been affected to that effect, but we are worried that if they do not get paid by the end of the month as promised, then it will definitely be disrupting services. I don't think anybody will be able to continue that like that.
Bongani Mazibuko, I appreciate your time. Keep us updated on the developments of this. We do appreciate you coming on tonight. That is the Gauteng Secretary for the Democratic Nursing Organization of South Africa, calling for accountability, especially on those who've been negligent as far as the payment of the health care workers.